So again, my name is Felicia Carbajal. I'm the Executive Director of the Social Impact Center, and I'm incredibly delighted to be here with all of you today to do this amazing training that's being brought to us from Americans for Safe Access. For those of you who aren't familiar with Americans for Safe Access, you should make yourself familiar. They're one of our oldest organizations working for access for many communities. Today we're super excited because we've been able to work with Heather on some other amazing things, but they come with a wealth of knowledge and information in particular to keep us as safe as possible as we are doing our National Expungement Week activities. Without further ado, because I know we've got a lot of ground to cover, I'm going to bring on Heather. Obviously, she's created this amazing PowerPoint presentation that we'll be able to make available to other organizers. We'll be able to make this available. This video will be available to everybody in the next few hours. And questions, please put your questions in the chat. I've done this with Heather a few times. She is incredibly thorough. So I feel as though we'll give her the opportunity to go through her presentation and then ask all of those questions, because I'm pretty sure she'll go over all of that. So again, I want to introduce Heather. I'm sure that everybody's read her little bio, so I'm not going to go over the bio specifically, but she's a wealth of knowledge and information. And I just want to thank you so much for coming today and bringing us this knowledge. Thank you, Heather.
Yeah, no problem. Thank you, Felicia. Like she said, my name is Heather Dapre, and today we're going to be talking about some food safety, handling, and safety to help protect yourself while you are volunteering for National Expungement Week. I am the director of the Patient Focused Certification Program at Americans for Safe Access. Americans for Safe Access is a 501c3 nonprofit whose mission is to advance access to medical cannabis for patients who need it through therapeutic use and research. And the PFC program is a cannabis standard for the industry that helps businesses ensure that they are in compliance with not only the state regulations, but also in compliance with PFC recommendations that will help ease the transition to potentially incoming federal regulations at some point, when they happen. My background is in chemistry. I was also a licensed nurse's aide in college, so I've had thorough training on handling infectious diseases, bloodborne pathogens. I am also a huge germaphobe, so I'm going to help you guys protect yourselves and stay safe so that you do not contract COVID. Today, we are going to talk about the CDC's guidelines and recommendations with regard to personal protective equipment. You're going to be getting safety glasses, masks, face shields. So we're going to talk about how to properly put those on, take them off, keep them clean, as well as dispose of them. We don't want a giant littering mess going on. We're going to talk about safe food handling. You guys are going to be distributing various food products, whether they be packaged or open. So we'll talk about some strategies for handling that. Our goals are to reduce the risk of contamination or infection, reducing the spread of disease, and we want you all to stay healthy, as well as all of the people that you're going to come into contact with. Not just attendees at National Expungement Week, but also the people that you're going to encounter on your way home and at your home. So the first step to staying safe starts with you guys. If you are currently exhibiting signs or symptoms such as having a cough or a high fever, it's recommended that you stay home. Unless you are 100% sure you don't have it, you've had a test recently, you're absolutely positive. If you have signs and symptoms, it's best to just stay home. Find other ways to volunteer your time and your services, but we don't want to continue to spread this disease. Some things to keep in mind before you leave your house. There's a lot of different things going on, and there's a lot of different ways that you can help protect yourself. And it starts with what you choose to do before you leave your house. So starting with your hair and your clothing. If you have long hair, if you are prone to touching your hair, putting it back outside of your face, or if you're like me, you have glasses, consider tying your hair back so that it is not something that's going to be in your face that's going to be bothering you. If you have things like seasonal allergies, consider taking your allergy medication before you get down there. You don't want to run the risk of having sneezes or coughing or having itchy, watery eyes. Those are all the entry points for COVID into your body, your mouth, your nose, and your eyes. And so you want to make sure that you are avoiding touching these at all costs. So if you have allergies, take allergy pills. If you have long hair, tie it back. With respect to your clothing, this isn't really something that people think about a lot when they go out of their house, but your clothing is going to come into contact with the outside world. It is going to potentially have airborne droplets on it. And so if you're able, consider bringing a spare change of clothes with you that you can change into before you go home. If that's not possible, consider wearing layers so that when you're leaving the event, you can take off that outer layer of clothing and not run the risk of anyone coming into contact with potentially contaminated clothing. If you have any other illnesses or injuries, if you have the flu, if you have a cold, or if you have an open wound, like a cut on your hand or something like that, you want to make sure that they're covered. If you have a communicable illness, if that's not COVID, I would still stay home because you don't want to transmit any diseases, not just COVID, to other people. If you have an open wound, you don't want that to become a source of contamination. And so you want to make sure that that's covered with a bandage. The other thing that's super fun is we're going to be talking about the use of hand sanitizer. So if you have a cut on your hand, you will 100% find out very quickly the first time that you apply hand sanitizer. So you want to make sure you have Band-Aids. Those things are covered. They're not going to be an issue for you while you are there. So just want to talk about making sure that you're staying safe before you're even leaving your house. Once you leave your house, what is the number one thing that you can do to keep yourself protected is wash your hands. Washing your hands is by far and away the most important thing that you can do. There is definitely a science to washing your hands. When I was taking my test to become a licensed nurse's aide, literally part of the test was having the person stand over me and watch me wash my hands properly. That's literally a test item for people. So if washing your hands is a very critical aspect to keeping yourself safe. You want to make sure that you're using water of an appropriate temperature, that you are thoroughly getting into all of the cracks and crevices that could be in your hand, especially if you're like me, you're a little older, got some more wrinkles going on. Want to make sure that you're getting everything clean. The other thing is jewelry. So if you're wearing like any rings, hand jewelry, anything like that, cleaning those in. Ideally take those off and don't wear them to the events. Hand jewelry poses a risk of puncturing gloves. So you might be having to go through more gloves than you ideally would like to. It also is a harder to clean place. You got to make sure you're cleaning in between each item and underneath each item. And if you don't want to deal with that hassle, I would suggest just leaving hand jewelry at home so that you're not having to worry about whether or not you're actually cleaning in between it and possibly having any germs or illnesses come home with you. If hand washing stations are not immediately available, there is going to be hand sanitizer that is provided. Hand sanitizer, lovely stuff. You want to make sure that this contains at least 62% alcohol. That is the minimum amount that you're going to need to be able to disinfect the germs on the top of your surface of your hands. When you apply hand sanitizer, you want to do the same thing that you do when you're washing your hands. And so you're going to put it on your hands. You're going to put a nice healthy amount. If it's dripping, so what? The more the merrier. This is not the time to be frugal with these types of things. So a huge dollop of hand sanitizer and go through the same process, rubbing it in and out, rubbing it around your hands, making sure you're getting in between all of your fingers and in the cracks and crevices. It's just as important with hand sanitizer to do the same things that you do when you wash your hands. So personal protective equipment, also known as PPE, you probably heard that word thrown around a lot. obviously this person is hopefully I didn't just get cut off there for a minute. I think I just got let back in. Share my screen again. Okay, perfect. Gloves. So there are a lot of different types of gloves on the markets, and each one is suitable for a different task. You're likely going to be dealing with nitrile gloves or latex gloves. Nitrile is the most common. People have started to veer away from latex just because of latex allergy issues. If you do have a latex issue, I would suggest talking with your volunteer coordinator to make sure that you have access to nitrile gloves that are going to fit your hands and work the way that they are intended to. Changing gloves and putting on gloves. So with gloves, there are some definite things to keep in mind. In all likelihood, you're going to be sharing boxes of gloves with other people. So the first thing you want to do before you even think about taking a pair of gloves out of the box is apply hand sanitizer. Hand sanitizer so that your hands are clean, because other people are going to be using those gloves too. And so you don't want to run the risk of having anything on your hands transfer to other gloves that are in the box. So prior to that, hand sanitizer. When you get the gloves out of the box, you want to make sure that they fit. One of the challenges with gloves is if they're too small, in addition to the rings, they're going to be prone to breakage. They're not going to cover you. You could rip them and tear them. If they're too big, they're kind of bulky and clumsy. You're not going to be able to do the activity that you need to do as effectively, and you may spend time adjusting your gloves. If you're adjusting your gloves, you're touching yourself, and you run the risk of giving yourself contamination. So when you get the gloves out of the box, after you've already applied your hand sanitizer, you're going to go ahead and put them on. Make sure that they are fitting as best as possible. And then have your gloved hands. One thing to keep in mind is that gloves do give you a false sense of security. You're like, oh, I got gloves on, I can touch everything. Well, you can, but whatever you touch next is going to have what you just touched on it. So even when you're wearing gloves, you want to make sure that after you have come into contact with a person or an object, that you are using hand sanitizer. If there's a limited supply of gloves, you can apply hand sanitizer directly to the outer surface of the gloves, or you can change the gloves directly. If you are applying hand sanitizer to the gloves, you do the same thing that you did with your hands, a nice, healthy, liberal amount, rubbing it in there, getting it through all of the surfaces of the gloves. One of the things to keep in mind when you're doing this too is the part of your hands that's on the gloves, you don't want to touch your skin with. You want to avoid doing that at all possible. So when you're taking off your gloves, there's some specific steps that you want to do to help prevent the spread of contamination. And one thing to keep in mind, especially with your hands, always, even if you just put hand sanitizer on, assume that your hands are dirty, especially for this type of a gathering where there's going to be lots of people there. You are wanting to make sure that you are protecting yourself and them. So use liberal amounts of hand sanitizer, keep them going. When you're ready to take your gloves off, there's some key steps to make sure that you don't touch yourself. So just like the picture, you want to start by pinching a little bit of the glove that's in one hand and then pull it off so it's inside out. Now this glove, you're going to wad up into this hand and then take 2 fingers, put them inside, being careful, trying not to touch any of the other outer part, and then hold the glove inside out off of your hand so that now the exterior of the glove is on the inside and the interior is on the outside. It's safer to handle, and then make sure that they're being disposed of properly. Proper disposal, especially if you are coming into contact with known illnesses, is very important because we don't want this disease to spread through trash and through litter. And we don't want anyone, if this is an event in a public space, there may be homeless populations. We don't want them to encounter this either. And so we want to make sure that these are disposed of properly and that we're not spreading illness and contamination. So face masks. There are 4 primary types of face masks. We're really just going to focus on the surgical face mask and the N95 mask. Elastomeric respirators and power air purifying respirators require training on their use. They are required to be fit tested for the user, and they're expensive. They're just not applicable to this type of situation. So surgical face masks, these are the most common ones. These are probably the ones that you're going to see everywhere. These are regulated by the FDA. So the Food and Drug Administration controls surgical face masks, and they base this on filter efficiency. So how well do they filter particles coming in? Breathing resistance, how hard is it to breathe? A lot of people complain, oh, it's so hard to breathe in a face mask. They're designed to have some level of breathability in them, and it may not always be ideal, but this is the way that we protect ourselves. They're also regulated for fluid resistance. So as you're talking, you're spraying droplets out of your mouth. That's just kind of what happens. It's a natural thing. How far they go depends on your face mask. So if your face mask is blocking you fully, they're going to get trapped by your face mask, and it's going to resist fluid going out. They're also going to resist fluids coming in, so that if someone sneezes on you, coughs on you, is jogging past you furiously and spitting everywhere, you're not going to get that into your mouth. And they're also evaluated for flammability. They need to be made of inflammable materials. This is generally a requirement for also most clothing these days. So if you are using a cloth mask or something that you've repurposed out of cloth, that should have some level of flammability protection. Surgical face masks do have limited protection. They don't fit tightly around your face. They may be prone to leakage, and they are single use. However, they are effective if you have the right material. So one of the things to keep in mind is not all of these face masks are the same. So single layer fabrics like the gator style neck masks or bandanas are not as effective, and they may actually now, studies are showing, maybe more problematic, because what can happen is instead of having your face mask catch these large droplets that are coming out of your mouth, that droplet is essentially going through a screen and getting dispersed as smaller particles into the air. And so those are not ideal, especially for this type of a situation where you know you're going to be coming into contact with other people. Those are more so like if you're out on the hiking trail and you may randomly come into somebody, that's a more appropriate time to wear a single layer type of mask. When you know you're going to come into contact with people, you want to have something that's a bit more effective. N95 surgical masks are certified by NIOSH. They have more stringent requirements than the FDA. These are designed to be used in occupational settings, hospitals, healthcare scenarios, nursing homes, that type of thing. But they're becoming more available to the general public these days just because of COVID. These help reduce your exposure to small particle aerosols. So instead of those larger droplets, it's like if that got sprayed through a single layer mask, it's going to have better protection against aerosols. These are single use. They are designed to fit the person's face, so they should fit fairly securely around your nose and your mouth. You should always check the seals prior to use. And in a hospital setting, they can be used in a sterile field. Not all face masks are made the same, as we talked about. You want to make sure that they have multiple layers. So this is my lovely face mask that I use when I go places. It has 3 layers. It has an outer fabric layer, it has an inner fabric layer, and this one's super handy. It has a little filter layer on the inside of it. And so this is what I wear when I go to the grocery store or when I know I'm going to come into contact with other people for sure. In this slide, there is a link to the CDC website. They have a number of suggestions for face masks in terms of the materials and their construction if you are not using a provided face mask. One of the key things to remember also is that certain types of face masks have exhalation vents or valves. You absolutely want to avoid those because the primary goal of this is to not let what you're exhaling get out into the general air, because that's how people are going to get sick. And I love this picture. It's a little gross, this cranky looking old person here. But this sort of highlights why we are talking about socially distancing at 6 feet. So as you can see, just normal exhaling, you're breathing, you're la la la, that droplet's still going about 1.5 meters or about 4-ish feet. If you cough, that's probably going to go about 2 meters. This is the 6-foot social distance that we're talking about. And this is why there are conversations about, is 6 feet adequate enough? Because when you sneeze, your velocity is a lot higher. And so you have a larger chance of getting that to cover a bigger distance. And so face masks are definitely the best way to help protect others from you. And it's not just COVID. If you have the flu and you got to run to the grocery store, or you just got a cold, maybe consider wearing it even when we're not in the middle of a pandemic, to help protect the people around you so that they're not getting sick from this. There are definitely some proper ways to wear a mask. On the left here, we see the proper way. You've got your 3 layers here. You've got a barrier, and this is blocking anything coming from outside, from inside your mouth to getting outside. How not to wear a mask. There's a lot of different ways. The escape hatch, hilarious. Loved that meme of the girl eating the donuts. Not effective in preventing the transmission of illness because your mouth is exposed. Clearly your face is not covered. If your nose isn't covered, ineffective, not working on it. Mustache, nose plug, neck beard. Wearing it under your neck is actually worse, because anything that you have on your neck, let's say you're getting ready to go out of your house, oops, add an allergy sneezing fit, that's now down on the front of you and potentially on your neck. So by putting your face mask down on your neck, you're contacting your face mask with those potential germs. And that's just another way to be able to spread disease. The next thing you guys are going to be provided with, in addition to face masks, is a face shield. And I went ahead and got myself a little Amazon order so that I could demonstrate this to you guys. So if you are the volunteers who are setting up the stations for people and you are receiving products in their packaging, what you want to do is go ahead and wipe off the surface with whatever disinfecting spray that you're using prior to opening it, cleaning your hands, putting on hand sanitizer, putting on gloves if you need to. Then you're going to open up your face masks. Each one should be individually wrapped. Some of these are designed for single use, and some of them are designed for multiple use. This is a multiple use face shield. It's got a nice little foamy patch here and a non-adjustable elastic strap. This is not a substitute for a face mask. This face mask is going to cover 2 out of your 3 most important areas of your nose and your mouth. This is really only to protect your eyeballs. So you're going to see a lot of like dentists and doctor's office and people like that having it on. This is going to help you if somebody is coughing or sneezing directly in your face. And so when you're putting on your face shield, you want to already have your mask on. I want to make sure you guys can see me talking and hear me talking, so I'm not going to put that on. Make sure that you have got your hand sanitizer that you've cleaned your hands off with before you touch the face mask, and then put your face mask on. The face mask should ideally wrap around your face so that the sides are protected, and it should go below your chin so that your chin is protected. So this is an added layer of protection, but it is in no way, shape, or substitute for an actual face mask. Surface cleaning. Check my time here, perfect. So there are a lot of disinfectants that have been approved for use in fighting COVID-19. The Environmental Protection Agency approves all of those mixtures, solvents, solutions. The primary ingredients for most of these are sodium hypochlorite, which is bleach, hydrogen peroxide, or quaternary ammonium. These sound like really big, scary words, but they're not. They're really common household cleaners that you likely have around your house. But one of the things to keep in mind is that you always need to follow the manufacturer's instructions. when you're at home, you may not necessarily think about, oh, I'm cleaning, I spray my stuff, I wipe it down, I'm good. That's actually not the way to disinfect. That's really just cleaning. That's not disinfecting. So you want to make sure that you are following their instructions. And so I have this wonderful jug of household bleach. And so on this jug of household bleach, there's a lot of things to pay attention to. Right here is your active ingredient list. So this is going to tell you, oh, this bleach solution is 6%. It's also going to tell you that what you should do for different uses. So on the back, whoever actually reads this, it's super helpful information. So laundry, if you are disinfecting your clothing when you come home, follow the instructions for laundry. If you are disinfecting surfaces like your pens, countertops, tables, things that you may be using to come in contact with, you want to follow these directions. And so these directions say use 3/4 of a cup of bleach to 1 gallon of water. You always want to make sure that you are following these directions. Step 2, though, is spray on surface and leave for 10 minutes. So that 10 minutes is the amount of time that it takes for the bleach solution to effectively disinfect the surface. If you do not have 10 minutes to wait, then I would consider using some other solutions. There are some hydrogen peroxide products that only have to be on the surface for 3 minutes instead of 10 minutes. But if you're disinfecting your products at home and you have time to wait, then you may have that kind of time. It's really just up to whatever's going to work best and what's provided for you. Some things to keep in mind, beware of imposters. There are an amazing number of people who want to capitalize on these types of things. And so there are a lot of products out there that say effective in fighting COVID. And this goes not only for cleaning solutions, but this goes for other things like dietary supplements. The FDA has issued a lot of warning letters, not a lot, a number of them, to people who are falsely stating that their products are going to prevent a person from getting COVID. It's not true. Always double check. So this slide has a link to the EPA's list of disinfectants that have been approved to treat COVID. And they update it as often as a new product gets approved. And so this is the most accurate way to find out what products are safe to use. The other thing is never, ever mix these things together. All of these solutions, especially the bleach and the ammonium, will be diluted with water. Hydrogen peroxide is already fairly well diluted, but some stronger industrial grade solutions do require you to dilute them prior to use. But if you are mixing things like bleach and ammonia together, you can get very toxic gas byproducts that can kill you. You never ever want to do it. You especially never would mix them in an enclosed place, but always follow the directions and the instructions. And that goes with disposal also. So once you have done your cleaning, you've wiped it up, if you're using paper towels, those need to get disposed of properly so that people aren't getting sick, that bleach isn't infecting potential groundwater or storm runoff. And this is another way to make sure that you're staying healthy and keeping everything healthy around you. So social distancing, this is not really going to be applicable to you guys. You're going to try as hard as possible to stay 6 feet away from people, but they're just not going to be able to do that 100% of the time. You're going to be handling materials, handling pens, checking identification, doing whatever you need to do, handling over food supplies. You're going to come into contact with people. And so maintaining that 6-foot distance, do it whenever you possibly can. But if you can't, try and really limit the number of people that are in one area at a time. Make sure you've got effective signage up there that helps people remember the 6-foot distance. It's not always easy to identify how big 6 feet is, but by putting markings and signs up, that will help people who are attending this event also be able to maintain that distance whenever they need to. Also want to make sure that there's the correct amount of hand sanitizer, maybe having hand sanitizer stations located around the event to make sure that attendees also have access to it and not just the volunteers. So handling paperwork. So what do you do if you have to come into contact with somebody? Make sure that, this sounds really weird to say, but treat them as if they are sick. Treat them as if they have a communicable disease, even if it's not COVID. Treat them like you would treat somebody who had the flu. The key being as minimal contact as possible. So if you are touching a pen, try and have a pen supply so that after you hand somebody a pen, they can either take it with them like some events have done, or you can put it into a box of pens that have been used that need to be sprayed and disinfected, and you can kind of rotate those through. If you have to hand a pen to somebody, touch one section of the pen, hand it over to them so that they can touch another section, and then take it back. And then you immediately want to disinfect that pen afterwards. If you don't have spray disinfecting supplies, good old hand sanitizer will work. Healthy dollop in your hands, rub it all over the pen, let the pen air dry before you use it again, should be good to go. If you're having to handle paperwork or clipboards back to people, similar principles. Touch one section of it, hand it to the person, let them do it. As they hand it back to you, attempt to touch that same section that you originally touched so that you're avoiding touching the sections that they have touched. If this isn't possible, always use hand sanitizer. I would actually just use hand sanitizer anyways, no matter what, every time you come into contact with somebody. And then afterwards, after you're done with that interaction, wash your hands or use hand sanitizer. The more that you can thoroughly wash your hands and not rely solely on hand sanitizer, the better that will be, because you're effectively rinsing those away. With the hand sanitizer, it works, but it's still not a substitute for washing your hands. But it's going to work if you don't have that option available. And if you have to check somebody's identification, similar concepts to handling paperwork back and forth. If possible, just have them hold up their ID so that you don't have to touch it. You can just read it. They can put it back in their wallet or purse. Or if you're at a table, have them set it down on the table or the counter so that you can look at it without touching it. And then same thing, wash your hands or use hand sanitizer afterwards. Food handling. So food handling is a little different. All of the food I've been told is either going to be prepackaged or vegetables. It's not going to be hot food that you have to worry about maintaining a temperature, or cold food that you have to worry about maintaining refrigeration. So you want to make sure when you're handling food that, once again, you're putting on clean PPE, that you're washing your hands or using hand sanitizer after you have put on your gloves, and that when you're touching food, you're only touching one thing at a time, if possible. So if you're creating bags of things for people, try to have them set up in stations so that you can just touch the one item you need and then hand it directly to the person or put it in their bag. And then once you've got everything in the bag, give it to the person. After you give the food to the recipients, you want to make sure that you advise them of what to do with it when they get it home. If it's a packaged food where it's a plastic wrapping or a cardboard box that has a plastic or foil wrap protecting the food on the inside, you could wipe it with a surface cleaner or spray it and let it disinfect, or just let it sit for 48 to 72 hours to allow the half-life of the disease to reduce, so that if it is contaminated, the disease is dying off and you're able to do it. If it's unpackaged food like vegetables, have them wash them immediately when they get home and make sure that they're cleaning it and letting them dry thoroughly before they handle it or consume it. If there is a concern about it, advise them to cook the food prior to eating it, but thorough washing, cleaning, and drying should be safe enough for that packaged food, especially if you're handling it properly and not cross-contaminating things. So ideally, you're only touching one food item at a time before you change gloves or clean your hands in between. Or if you're handling multiple items at a time, you're handling it for one person and then changing your gloves or cleaning with hand sanitizer before you go and get anything for another person. After the event, so we've talked about before and during, and now we're going to talk about after. So before you leave the event, you want to make sure that you are taking off all of your PPE properly. If you have your gloves, your face mask, and your face shield still on, which you should, then you want to make sure that you remove your gloves first, or you disinfect your gloves the way that we showed you, and then take your face shield off. If they're disposable face shields, dispose of them properly, or if they are multi-use, then give them back to your volunteer coordinator for disinfection. Then take off your face mask, and then always wash your hands. So this is the time where you absolutely want to be using water and soap and paper towels to wash your hands before you go home. So hopefully if there are washrooms with washing stations, you can do that. If not, good old hand sanitizer until you can get home. The other thing is, if you brought that spare change of clothes, now is when you're going to want to put those on, or if you dressed in layers, to take off the outer layer before you leave the event site. That is when you're going to want to change. After you've taken off your PPE, you're disinfected your hands, you're going to change your clothes if possible. This is because you're going to encounter people, either if you're driving, if you're taking public transportation, or if you are walking. You're likely going to encounter people either at home or on your way home. And so we want to protect those people from anything that may have come onto your surface. So that's why we want to change that outer layer of clothing in case, if you walk up to the coffee counter and lean on the counter to go order an iced coffee to walk home with, whatever's on the front of your shirt that you've now leaned onto the counter with has now rubbed off onto that counter. And so there's this whole progression of how we can trans that way. And so you want to make sure that you're doing not possible to change your clothes, wear outer layers, then you really want to avoid coming one. Once you get home, you want to make sure that you're taking off your clothing immediately and washing it if possible. So if it's not possible to immediately dump your clothes into the washing machine, separate them and put them in a plastic bag. Keep them in the plastic bag until they're either ready to be laundered or for at least 48 to 72 hours. This is going to help protect your other items at home from whatever that clothing may come into contact with. If you've also used anything, personal items like your pen, or if you went and touched your cell phone, you want to make sure you're cleaning and disinfecting those as well. If you left the event with your spare clothes in a backpack, that backpack you want to also clean. Ideally, you would put your spare clothes in a plastic bag and then dispose of that plastic bag once you're done cleaning your clothes. If you've left with a backpack, clean that backpack. There are directions for laundry, soft surfaces, different types of materials and fabrics to be able to clean and disinfect them. So if it's a purse, there's ways to wipe any materials, leather, faux leather, whatever it is, off, to make sure that whatever you touched during that's from the moment you left your house until the moment you got home again is disinfected. So like if you're driving, every time I get in my car, goes a hand sanitizer, and I rub the steering wheel with it and the gear shifter, all of that good stuff. So the goal is to get rid of any potential germs that are on your surface before you get home or before you come into contact with anyone else on your way home. And so I realized that with this screen view, there were a couple of things that I wanted to mention in terms of safety before we dive into questions. With regard to face masks, you want to change these as necessary. So you're going to be wearing these throughout the day. So a lot of people complain about having to wear them all day long. It is kind of annoying. So if possible, try and schedule face mask breaks away from other people so that you can have just a little break. The other thing is you want to make sure that you have multiple face masks, because if this is an all-day event, you're going to be talking, you're going to be breathing, you're going to be listening, you're going to have droplets, your mask is going to start getting wet. So if that face mask is wet, it is not effective in preventing germs from coming into your mouth. And so you need to change your face mask as often as needed, but especially if you notice it's starting to get like damp, you want to make sure that you've got a new one to get on. I think that was the big thing with face masks. The other thing with face masks is most of them have this little wire thing in the top of them. This is to help you. I wear glasses. I just got a new pair. I kept joking that I wish our insurance would just automatically give me anti-fog, but they don't. So if you want to try and prevent your glasses from fogging up, you want to make sure that this metal piece is adjusted and that your glasses are kind of over it. This should help prevent that warm air from coming up to the top if this is secured down on the top of your face. The other thing is if you wear glasses, try and make sure that they're adjusted so that you're not having to touch your face to adjust your glasses, which is going to be really challenging with gloves and a face mask and a face shield on. But you want to make sure that these are all used properly and disposed of properly. And so, oh, this is great timing. So I'm going to open this up to questions. I'm going to attempt to find the chat here. If there are any. Let's see. So hand sanitizer could be used as a surface disinfectant. Yes, it can be, as long as it has that minimum 62% alcohol solution. If you are using hand sanitizer as a surface sanitizer, it's not ideal, but it is what it is. You want to make sure that you let it dry thoroughly before you use that item again. If you don't have some sort of like spray disinfectant solution, the hand sanitizer will work. You want to make sure that, yeah, you're allowing it to dry before you use any of those items again. Let's see, LA will be giving away the pens. Perfect. Then you don't have to touch anything else. You don't have to worry about it. How should you go about people who neglect those safety protocols? I don't know whether or not people will be denied admission to the event if they are not following these safety protocols. But the best thing that you can do is to remind them of the policies, advise them. I don't know if there is going to be PPE given away to attendees if they don't come, if you can provide an attendee with a mask. Okay, so attendees can be provided with masks. They should be required. We're still under shelter in place. And even if masks weren't required right now, I would still wear one. You protect yourself. This is the thing about being a germaphobe, is if you assume that everyone is sick, then you have a better chance of protecting yourself. And if you're protecting yourself, you're protecting the people that are around you. And those are the people that we want to protect, and we want to protect ourselves. Most of us are probably quite healthy individuals, and that's why we're volunteering our time to do this, so that we can get out into the community. But if you are immunocompromised, you have other conditions that may cause you to be a more high risk, then you want to make sure that you're protecting yourself and not getting this. And so if people are neglecting the safety protocols, remind them, give them a mask, give them hand sanitizer, make them do it. But if you're doing things properly with your gloves and your face mask and your shield, you're going to be protected, and your clothing. Do you suggest taking infrared temp checks at the entry? That is going to be up to the event organizers. A lot of businesses are doing it, especially if you're going indoors to like a dentist office or a doctor's office. They are checking temperatures. But that would be a policy of the event coordination to determine if they're going to check temps. I don't know if you have anything to add to that. Oh, Felicia says, so LA will have temp checks. So people are going to get their temperature checked. Word of advice with temperature checking. Personal experience, I made this mistake at the dentist's office the other week. It was really hot, and we had gotten to the dentist a couple minutes early, and we had to call them and say, we're here, come and take my temperature. And then I stood in the parking lot in the hot sun for 5 minutes, and then I had a temperature of 105, and they wouldn't let me in. And then I had to stand under the air conditioning vent to cool down fast enough. So if there are temp checks, try to get them done as soon as people get there, so that they're not waiting outside, potentially elevating their temperature, giving a false high reading. Michigan will have temp check guns and mandatory masks. Yes, perfect. I would definitely make masks mandatory. They are really just one of the best ways to help people with what's coming into their mouth and out of their mouth. And then there is signage everywhere that is very critical to make sure you have the signs, that everything is marked. I think signage really helps people to understand, like, this is not negotiable. So as long as attendees are aware that this is mandatory and you will not be admitted and you have to follow best practices, that gives you recourse if people aren't compliant. Then I think you have the ability to say, then you are no longer welcome here if you are not going to comply with our requirements for safety, because safety is big for everyone. And I'm already breaking my own rules because I need to get my glasses refitted. Yeah, are there any other questions? My email address is up here. I will share the presentation with Felicia so that you guys have access to some of those CDC links and EPA links that I put in there. And feel free to definitely reach out if you have any additional questions ahead of the event. It doesn't look like we have questions, so I think we're good. Felicia, I don't know if you want to end the meeting for everyone, or
Sure.
if you have other things to talk about with the volunteers.
I've got just a couple of things, so if we can stop the screen share, that would be amazing. Hi, everyone. Couple of things to just, I know that came up during the presentation in particular, is that signage. I would advise everybody who's doing their different events to just make sure that there's additional signage. So, you know, we have some big signage in LA, but we'll have some additional signage as well. I'm excited. I feel I'm going to be going to every single hub, at least doing drive-bys. So this, for me, is very informative and makes me feel a lot safer. So I want to thank you so much for the time that you took to put this together, and then the time that you took to share information. We are going to be providing masks. If people don't put on the mask, we will be asking them to leave. I mean, obviously, this is a police yourself type scenario for all of us who are participating. Like, I'm not going to call the cops if somebody's not wearing a mask. I might go grab my bat from the car and help push them out. But we are providing masks. We're going to have additional masks for everybody who's coming. I know personally, like, I have masks that I like because I'm a princess, but I know that I'm also going to be wearing some of the surgical masks just for the added level of protection. But there's definitely going to be masks provided for everyone. Are there any more questions, guys? Awesome. Well, make sure to have a very safe event. Be cognizant of everything that was shared. And like Heather mentioned, I'm going to be sharing this information with the rest of our team and everybody who asks. The Monday night meeting, there will be a second replay for all of the national organizers to be able to participate. And if we have any questions, we'll be able to reach out to Heather directly. Thank you again for this time and sharing your knowledge with us. Everybody have a great weekend. Be safe. Do plenty of self-care. It's foot on the gas, but definitely make sure to take some time for yourself. Have a good one, guys.
Right,
Bye.